Hi, Matt. You can't really see us super well because we're socially distanced.
Good. I don't want the camera too close now.
Here's my hand over here.
Hey, Sarah. Hey, Carmel.
Hi. And then Beckie's here too.
Oh, Becky, hi.
Hi, Matt. We got all three of us today.
Oh, cool. Okay, well, shoot. Let's get into it. My wife might walk in here. She doesn't know I'm doing this, so I might have to be like, shh, real quick.
Okay.
Well, thank you for joining me today. Just for clarity, this I think is going to go on KMUD's community news, just the conversation today. So maybe we could just do a swing around where we could introduce ourselves and our role. Hi, darling. I'm on a Zoom here.
Hi,
Matt's wife.
Wife's name? What's her name?
My wife's name is Patience. No, it's Erin.
Hi, Patience.
Very good.
So my name's Matt Lefevre. I'm with KMUD and Redheaded Black Belt.
Is that you?
Oh, Sarah Dukett, Public Information Officer for the county.
Carmel, Angelo, Mendocino County CEO.
And I'm Bekkie, Emery. I'm the Department Operations Center for Health and Human Services Manager.
Thank you for joining me today. Really appreciate it. I have a list of questions here. I want to respect your time. We'll just get right into it. I was just reading the recent public health press release regarding the new restrictions associated with the surge in cases. One question I've been getting from residents has to do with surge capacity and what resources our county has or has access to that we can utilize if cases start picking up quickly and starts pushing up against our surge capacity. Maybe CEO Angelo could address that.
Sure, thank you. So first of all, it's really, this is, sometimes Matt, it's difficult to talk about this because we have been in it so much that it becomes emotional. And so sometimes you have to really step back and just take a breath before you could even answer these questions. We have been in this since January, and Dr. Dukett has been working on this actually since the fall. The state of California has been preparing, knowing what's happened nationally and knowing what's happened on the East Coast. So we have been getting reports and working with Dr. Dukett on this, and then of course we know by March, boom, we're full boat. So we have had time because we've had a slow progression. We have had more time to actually staff up, train our staff, work within the departmental operations structure, get more people trained to do contact tracing and investigations, and then of course testing. So right now, no matter how prepared we are, and I would say this because, the only difference right between COVID and a wildfire is that you can see a wildfire, and you have a wildfire, it doesn't matter. You can have as many firefighters as there are in this state and in the state of Nevada, but if that wildfire is so big, they may not be able to contain it quickly. And so all of the preparation that we've done, it has been helpful. At this point, we have a surge, we have uncontrolled community spread. We don't know where the surge is going to go, how long it's going to be here, and how big it's going to get. So we call for mutual aid with the state, and when you call for mutual aid, you do that because you say you don't have the resources to cover something. So right now today, we have over 20 contact tracers trained. We don't all have them working at one time because obviously we need to spread out our resources. It's not a 1 month fire, it's a year to 2 years, so we spread those resources out. So we have resources that we're still calling in, and we've also gone to the state with 3 requests, no less than 3 requests for mutual aid. We put in a request for additional contact tracers and investigators. Also for staff that will help us with the alternate care site. And we've also put in for other staff for some community partners. And there's one more request we put in that right now escapes my brain. But to answer your question, we have been preparing for this for months. Are we prepared? We're prepared. Are we prepared as best we can? We are. Are we going to meet this surge? We're going to meet this surge. We don't know, if we will have enough resources because we don't know how big it will get. We know that we have gone to the state and will go to the state for additional help if we need it. And that's what we know today.
Well, I think in general, most would hear those words as reassuring. Bekkie, are you the coordinator of the contact tracing, or one of them?
So in the Department Operations Center, I oversee all of our responses, be it the coordination for surveillance, the contact tracing, the case investigations, the managing of the case management for the people that are in isolation and quarantine. So I'm overseeing our response to COVID-19 for Mendocino County under direction of CEO Angelo and our health officer.
All right, thank you for the kind of macro of Bekkie Emery, what you do, and I'm gonna go like really fine pointed in the. I don't want to name the local business because a listener, a reader, they can go do the due diligence themselves if they're interested. But you guys probably know of the local business recently that went to social media, admitted one of their staff members tested positive. That local business closed after a couple days. That local business has now reopened today to the public. So just there's some layers here to this question, and I want to work up to it. And I'm wondering if you, Bekkie, can address this. You, Carmel, can address this. So my understanding is this local business encouraged its staff members, after finding that their coworker was positive for the virus, to go to the OptumServe testing site and be tested. They're not the totality of staff was tested because it wasn't a requirement or a mandate. It was a request or it was suggested. Now, we know that the OptumServe testing turnaround time is 7 to 10 days at this point. So some community members and staff members are not very confident to be able to say that all of the coworkers are COVID free because of the fact that it takes 7 to 10 days to be able to get results back. So for all intents and purposes, there could in fact still be a staff member with COVID there. So I also know that they opened with the green light of public health. Public health went through them in the process of knowing their sanitizing process, knowing what they did with staff. So in one end, there's the public anxiety associated with it still could be amongst the staff. And on the other end, public health gave the green light. So I don't know, I'm wondering from the DOC perspective, maybe from the CEO, how would you reassure the public in this context? Do you see this as this is kind of part and parcel to a pandemic? The risk is always out there, or I'd love to know your thoughts.
Sure. So let me start with how we do our investigations. So when we have someone who is tested positive, we have a really in-depth conversation with that individual by our case investigators to find out who they have been in close contact with. And that close contact is closer than 6 feet for more than 10 minutes. So as you can see in this room, CEO Angelo and I have our masks, but we are far more than 6 feet apart, as well as on our PIO side. So we would not be considered close contacts were one of us to come out positive, because we are further than 6 feet apart. So that's part of what we look at, okay? So we're looking at who are the close contacts with someone who tests positive. And once we've identified those individuals, not only is the person that we've tested or found that is tested positive, that person has been into isolation, and so they are isolating at home. Individuals that are close contacts, again, closer than 6 feet for 10 or more minutes, are put into quarantine. And so those individuals are also required to stay home for 14 days from the time that they last had contact with the person that tested positive. And the reason for that is because of the incubation period of this virus. And so what I would say is that, to our knowledge, all individuals that we, as we are doing our case investigations, we are having conversations with those individuals. We are working with various entities to check rosters of scheduling and employment, and verifying that we have the right people. For example, in a business setting, versus, someone who is, let's say, works in their office at a desk versus out at doing the deliveries for that business. Their interactions are far less. They may not have any interactions. So it's not necessarily every employee within a business that would be considered needing to be quarantined. And so those are the types of things that we are looking at. So who are those close contacts, and then ensuring that we are putting those individuals into quarantine. And so those are the steps that we take with the businesses that we've been working with. They also have, all of the businesses we have worked with have done a very deep cleaning after they've been notified of any positives. And so that's the partnership that we've had. And with that, I'll turn it over to CEO Angelo and see if she wants to add anything.
I think this is a tough one, Matt, because this is a classic case where, information gets out on social media and it goes like a wildfire. And, I'll tell you, from 2017 on, I really looked to social media to help get those messages out. But sometimes, it's like playing telephone, where by the time the message comes out to where it lands, it's not 100% accurate. This is a high profile business, as we all know. As a matter of fact, I will say that this is the one business that I actually walk into. It's probably one of the few that I actually go into. And so I think that they responded quickly to their one employee having a positive test. And the challenge of sending their employees to Optum for a test, I don't know where else they could have sent them. That's something that we're all dealing with. I think that given what I have heard and what Bekkie knows of the investigation on this, it seems that they did everything that they could. Now, short of closing down for 2 weeks to wait till everybody gets tested, they could have done that. They didn't have to do that, as long as the employees that were contacted or that had contact with the positive employee are not there at the work site, and we've been assured that they are not, then as far as we know, anything else would just be, guessing. And so as far as we know, they have taken all the appropriate steps to reopen and to keep themselves safe, their employees, and certainly the customers, of which, I'd say that probably everyone here enters that store. So at this point, we're not aware of a risk to the public's health, more so than going in any other store in this county.
Thank you for that. And the more I kind of looked into it, the more I spoke with management of that facility, the more I realized that maybe these are just another manifestation of sort of the public anxiety of this moment. This could be anywhere. You can't ensure security anywhere. I paid attention up in Humboldt County when there was a Aztec Grill that public health in Humboldt County actually outed for a potentially unsafe place to go, and asked that if anyone who had been a patron of that Aztec Grill to contact public health to kind of facilitate the contact tracing. And I guess, I'm curious, what's the threshold in your guys' perspective where public health feels as if they need to step in and kind of speak to a business in that?
Yeah, I would like to answer that. Coming out of 12 years of public health in a large county before I came up here, that is the practice, because what you care about more than anything is keeping the public safe and healthy. And so we can use this business as an example. If this business had a positive employee and they did not tell the other employees and they did not notify the public, we would have been compelled to say to the manager that, you know, these are the steps you need to take. And if you don't take these steps, then one, we can, by public health authority, shut you down for a period of time and until you take these steps. And two, we will notify the public. And so that is actually the proper procedure. I would say that we have done pretty well in this county with having those businesses that have had positive cases and have had to do follow-up actually come out and do that. So that is the public health process, and that's our way of protecting the public's health. So any business that has positive cases that is a county business within Mendocino County property, that if they have a positive and we know this and there is a risk to the public's health, if they will not go public, we will go public. And if the county goes public, you can bet we won't have to close them down because the public won't go there. So, you know, I'd say that we have had some very responsible business owners within the county over the last few months that have worked with us and have been concerned about their own businesses and their employees and the public. I don't know if you want to add anything else. Yeah. Did I
Transparent.
answer your question?
Absolutely, Carmel. Thank you. And I like your spirit. It's be transparent. Don't hide anything.
Well, yeah, well, thank you for that. But I mean, that's what you do in public health, you know, really. I mean, why do you think we have environmental health workers that go out and inspect restaurants? One of the first restaurants that we closed in the last 10 years was probably 6 years ago, where on a Saturday night, myself and the environmental health director showed up, and it was very clear that in that restaurant, they didn't have temperature control, and the food that they were serving possibly could make people sick. A Saturday night, we closed them down. So that's what you do when you work in public health and environmental health.
Thank you for that. I'm going to pivot to sort of, I have different themes of questions. This theme is communications. So maybe this is more for Sarah, but I'm sure all three of you can kind of speak to this in your own way. What are some of the common issues you've seen Mendocino County residents asking about COVID-19, maybe specifically on the hotline that's been set up, or maybe just some myths you'd like to bust, some information you think needs to get out there?
You know, I think one of the biggest myths that we need to bust is there are no gatherings. So we have our stable groups, and that's your family unit. That's 6 people, your close 6 people. But, you know, people think, oh, I can still have my backyard barbecue with 10 people, or, you know, go have a picnic at the beach with 12 people, especially with the under 35 population, and that's where we're seeing the rise. And people saying, oh, I want to do my wedding, or I want to do my birthday party, or, you know, and that's where we're seeing some of the transmission. It's even with smaller groups, and reminding people that we still have a ban on all gatherings. And that if you're going to have your stable bubble, to take that seriously. Those are your 6 people, and that's your only 6 people that you're around. And there tends to be a lot of confusion about masks, or people thinking masks aren't important, but it's really essential that we remember that wearing our mask when you're out in public is a requirement. It's not just for you, it's for protecting the people around you, and it's a good neighborly thing to do. Remember to wear your facial covering when you're out and about.
I want to follow up on that really quick. I was in grocery outlet yesterday wearing my mask in line, and there was a worker there, and she was talking to the gal in front of me about being fearful of asking people to wear masks because there's this line that's been getting thrown out regarding ADA, Americans Disabilities Act. There's like potential lawsuits involved for a business to ask someone or compel someone to wear a mask or not serve them. And Sarah, maybe you can speak to that. CEO Angelo, to me, that sounds like a really good way to hack someone's brain to get them off your tail for not wearing a mask, but might not necessarily be legally sound.
I can't speak to the legalities of it, but based on the state or on the local order, if you're over the age of 2, you need to wear a mask. Your exceptions are if like you're deaf and you need to see lips or use that to communicate, and if you have a health condition where your physician is saying it's unhealthy, which is why we also put in the order that if you can't wear a facial covering, we recommend wearing a face shield, because you'll be able to. You won't have the same maybe difficulty with a face covering. We have seen some businesses say you can't come in without a mask, kind of like the no shirt, no shoes policy, wear your mask. One thing that I've been encouraging people is if you're, where you decide to go and shop, that says a lot. So if you're seeing, people blatantly, disobeying the order, you don't have to go there. And we do have our call center. So if you're seeing a business that's repeatedly maybe not being the best with masking, you can always call our call center number and let us know as we kind of work on education and enforcement moving forward.
Thanks for that, Sarah. Yeah, I feel like that's kind of this weird intersection of a pre-COVID world and the world we're in now. Maybe at one point, ADA laws applied in a different pre-COVID world. So I wanted to ask about the interviewing of a potential replacement public health officer. It was during the last COVID update last Friday where there was references to vetting, interviewing. I'm wondering if there's any updates to that process.
Yes, Matt, as you know, the board hires the health officer, and on Tuesday, a few days from now, we are going into closed session with the board with appointment of health officer, and we have a candidate who has come forward who is a local physician, well-known, highly regarded within the community. He's been in this community for quite some time and has good experience and is very much interested in a full-time permanent position. We have had, I want to say this because we have had good physicians interested in this position, and unfortunately their schedules don't permit them to work full-time and take call and such. So with that, we have a physician now who has the ability to work full-time, be on call 24/7 and really be present with us. And so we will be bringing this person to the board on Tuesday for the board to review their resume and their application and to meet this person and to do an interview. So I'm hopeful that the board will take steps to hire the right candidate this week, and that we will move forward. Dr. Dukett has done an exemplary job for us over the last few months that she has worked with us, but we know that she was in the process of relocating her life to Southern California when she started working with us, and she has not abandoned us. She stayed with us through this process. But there comes a time when she will have to go to her new life, and we will have to move on without her. So we're hoping to find the very best physician. Again, I want to say this because we have had more than one good physician apply for this position. And what it comes down to is full-time capability and being available 24/7. But we absolutely need that right now. We are available 24/7 to respond to anything that comes up during this COVID experience, but we need the expertise of the health officer. Dr. Dukett has been available. I can call her any time of the day or night, but she does have another life to go to.
And we have like 2 more minutes because we have another call we're going to jump on at 5.
Absolutely. I really appreciate the time you've spent with me. And I reached out to Sarah a couple times this week associated with I'm doing segments for KMUD about Mendocino County updates. And I like hearing local officials like a PSA, like a call to action for from those officials towards Mendocino County residents. So maybe we can do a quick round robin, just a quick 30 seconds call to action. What do you want Mendocino County residents to do to help each other, to help us get through this tough time?
Matt, I want to start. I would like, you want to talk about a call to action? We did a call to action a few months ago when we needed people to come in and get tested so we could get our numbers up. We need OptumServe in this community, and we have it. So much so that they ran out of test kits today. So that's actually a good sign in some ways. That was a call to action. It was on social media, and Mendocino County community complied. What I would like to say right now and ask this community to do is to wear your mask. And I believe if for 60 days we could all wear a mask and socially distance, like Bekkie was saying, I think we could flatten this curve. We are in the beginning of a tremendous surge. When you think overnight, we have people in the hospital, we're going at 10 plus every day. This is the surge, and this is the surge that could overtake this community. Wear your mask, socially distance, don't have any parties, don't go to any parties, no gatherings. Thank you.
Thank you, Carmel. Bekkie, do you have anything you want to add in terms of a call to action to us Mendo folk?
Fantastic. Thank you for that opportunity, Matt. I would encourage people to be washing their hands regularly, and when you cannot wash your hands, use your hand sanitizer. Germs are on so many flat surfaces that we don't even think about, be it the machines at the stores that we're all using our cards in, the door handles that we're opening, all of those things are all carrying those germs. And so people make sure they wash their hands more frequently than they have been, and make sure they're using hand sanitizer if they cannot wash their hands for whatever reason. It's going to help keep us much safer as well and help in flattening that curve.
Thank you, Bekkie. How about no party fun Sarah over here? Do you have
Which is ironic. I would say that every single resident can make a difference, and you can make a difference by washing your hands, staying home when you're sick, staying 6 feet apart, wearing your facial coverings, no parties or gatherings, and if we can just keep doing this, we can flatten the curve, and we're in it for the long haul. It's not a disaster that goes away right away. We have to be vigilant and keep doing it so that we can keep not only ourselves safe, our family, but our community.
Love it, Sarah. Carmel, Bekkie, super great spending some time with you today. I really appreciate it.
Nice to
Matt.
see you.
Yeah,
Thank
see you
you,
later.
Matt. Take care.
Bye.
Bye, guys.